Hello, everyone. I am Serena Purdy, and I am the NDP candidate for MP in the current by-election that's coming up on April 13th. And I'm joined here by my colleague. I can't tell if you're on that, which side of the screen you're going to be on for the recording, but if you'd like to introduce yourself.
Hi, my name is Yipeng Ge. I'm a family doctor based on unceded, unsurrendered Algonquin Anishinaabe territory. It's good to be in conversation with you, Serena.
Thank you. Today, we're going to talk about two things. We're going to talk about National Public Health Week, and we are going to talk about Palestine. So, for National Public Health Week, just going to start out by saying I've been hearing a lot, and it seems to be a fairly recent thing, that healthcare is a provincial responsibility. And it's an interesting tactic when you start having the conversation about federal responsibilities for that to be the response because it's technically true, but it is a shared responsibility. Our governments at all levels actually share some of that responsibility, and we saw that through the pandemic. So the federal government is responsible for public health. So that's things like immunization. But there's different levels, right? We have Toronto Public Health too, and we worked with them to get our low and no barrier clinics established through the pandemic. But broadly, the federal government is responsible for Indigenous health. The federal government is responsible for administering the Canada Health Act and holding the provinces accountable when they don't abide by it. The federal government actually has harmonization mechanisms so that we have consistent standards and policies across the provinces. And they are also responsible, as we've seen with the cuts recently, for refugee and migrant health when they're in the first few weeks of their arrival. So I would love to hear if you have any thoughts on National Public Health Week.
Yeah, as as someone who's trained and worked in public health, I understand public health to be this like really broad framing and understanding of what impacts people's health in the broadest sense, right? Not just the healthcare system, which is primarily an illness-based system of treating and diagnosing illnesses and sometimes preventing illnesses, but understanding the structural conditions that affect everyone's health, including food systems, water systems, housing systems, all the things that allow us to live a long, fulfilling, healthy life. And I do think that is the role of public health, but it has been eroded over time because of various levels of government that want to see. Um, Kind of the ways in which our society is structured to be very siloed, not around like the well-being of people, but around profits, around propping up an economy that doesn't actually benefit the people, but benefits very few, like corporations or whatever investments are being made to really keep the profits flowing for a very select few in the community. Sometimes they're not even in the community. And so I think it's important to kind of keep that in mind as we try to kind of parse through how the healthcare system is structured, because it really the healthcare system only kind of constitutes, arguably sometimes 20 to 25% of the like highest attainable health that our community members are able to be able to be impacted through accessing health through or healthcare services through the healthcare system. But with that said, like what's within the power of the federal government or the provincial government around healthcare provision, like delivery of healthcare in clinics, emergency rooms, hospitals, this is being eroded across the country through privatization, which, kind of goes to say, it goes in line with what I was saying earlier, is we're seeing politicians support the privatization of these systems that are a public good, should be a good that should be accessed by everyone. In Canada, we understand this to be true, but not through previous friction and tension, where physicians were the ones that actually went on strike to prevent Medicare, publicly accessed healthcare, where you don't have to pay, where your ability to access healthcare is not on the on your ability to pay. That was actually fought against by physicians in Saskatchewan when it was first thought
Yeah.
to, wanted to be implemented. And now we're in a place where um, uh, there are more and more barriers to be able to access healthcare, and people are willing to pay, and it's gotten to be a situation where it's this bad, where people are looking towards private solutions,
Mhm.
where if they have the means to pay, that then they're willing to go for an MRI to speed things up. They're willing to go to a private surgical clinic to get a hernia repair or a knee replacement, a hip replacement. And this isn't the society that I think many people in Canada want to live in, because it actually erodes the system further, where we have a limited number of healthcare providers, nurses, staff to like fill the operating room, doctors, surgeons. And when
MRI machines.
yeah, and then when we create a multi-tiered system, and arguably in Canada we already have a multi-tiered system,
Mhm.
but when you make it worse, it will worsen access for everyone. It'll increase the costs for people who are accessing healthcare through private means, and then for those that aren't, um, will see increased wait times because there's a limited number of healthcare personnel to staff the
Yeah.
hospitals.
I think there's something kind of insidious about the way that we have this conversation in politics, particularly austerity politics, where it makes it sound so much like we're all saving money by cutting an essential service, right? But in the end, and this is what we discussed, um, I discussed with Dr. Samantha Green on the cuts to the Interim Federal Health Act, it doesn't save us in the long run, or even in the short run. The more we cut those social supports, the more we pay the price in many other ways in our communities, in the ER, in like the loss of human life, in delayed care and more severe outcomes, in more complex chronic outcomes, which are even harder for our system to deal with. And so it strains even more and more every time you cut. And it's not about, this idea that people have infinite needs and they're just going to always want more and more and more. I mean, how many kidney transplants are you going to want, really? Like if you need one, you should get one, right? And you're not going to be like, "Ooh, another round, please." Um, it's not as applicable, that concept that people are just having their hands out in a healthcare context, but it sounds appealing, and people will go for it if they're struggling because it sounds like it's within reach. But that's not leadership, and that's certainly not the kind of decision making that we should be seeing from people who are arguably part of a very comfortable class. So um, I think we have to make sure that we are educated, that we know that our federal government is absolutely responsible for health. I mean, I was looking it up, at the first federal health minister that had health in their portfolio was appointed in 1867. So it is absolutely a federal responsibility, and we should hold them accountable to it. Um, and I think on that note, I'm going to move over to another discussion that I know is very dear to you. In the last election, I took the Vote Palestine pledge, but I also said it could go further. I know that there was a lot of work on that by the group that put it together. I would like to continue to move that pledge forward, but I would also like to see us make sure that we're processing refugee applications faster and in a more humane way that maintains family structures. I would like to see us have more supports for refugees once they get there, instead of cutting the refugee health coverage and housing coverage that we've seen this government do over the last year. And I would like to see us honor not just international law, but international criminal courts. Um, what are your feelings on what's really important for this election, and what I know you've been very good at telling people the important things, but for this election in Canada, what do you want people to know?
Yeah, I mean, for this upcoming by-election, it's my understanding is that it's a turning point where the current existing Liberal government, Carney's government, is out to get a majority, and what they've already done in this position of being in a minority government and having really so many people cross over into their government from the Conservatives and from the NDP. It is a means to try to push forward this austerity agenda where they're telling everyday people in Canada there's not enough to go around. We have to cut, we have to cut everything but we're going to dump money, like money that we've never seen this much be invested before in an economy of war and genocide and militarism. And with the veneer of, oh, things will be all right. Like we'll take care of everyone. When the only people that are really profiting and benefiting from this are the companies that profit from war, genocide, militarism. And while this is happening, they're making these cuts, right? And these cuts are affecting everyday people and some community members that are in the most vulnerable and marginalized positions in our society. Like the refugee healthcare plan that you mentioned, the interim federal health plan that is being cut by the federal government. This is the health plan where refugees from places like Gaza,
Mhm.
like Sudan, have escaped genocide where weapons of war made in Canada have been found. And that kind of economy of war and genocide is what is going to continue to be funded and if not be expanded. And their healthcare, when they actually found refuge in a place like Canada where they've escaped the genocide, their healthcare is being cut. Their healthcare is being cut, right? It's like it's infuriating. Like it's
Yeah.
enraging to know that this is the reality that we're faced with. This is the reality that we can see plain as day. And
Yeah.
um, I think so many healthcare workers who work with refugees and asylum claimants like are organizing or pushing back have been. Um, but I think we also need to be talking about this with people who are seeking elected office to have a different kind of politics, right? And I see it with Serena, your party. I'm seeing it with the NDP, with Avi Lewis's, unapologetic way of approaching politics, of saying like, well, this is what we stand for, and we're going to do it, rather than like the existing politic of the liberals, which is we're going to say one thing and we're going to do something completely
The
different,
other.
and we're actually just going to lie to people in Canada, right? With arms shipments being a big, big lie, I think, from how the Foreign Affairs Office and the Foreign Affairs Minister truly did lie to everyday people in Canada, to their own members of parliament, to their own caucus, where I remember speaking to members of parliament in the House of Commons who were in the Liberal Party who just bought the lines they were being told by their foreign affairs minister that, oh, we're not sending weapons to Israel through the US, when
Yeah.
their own parliamentary study showed that they were uh,
Yeah.
like shipments confirmed through movement leaders with PYM, with World Beyond War. PYM is Palestinian Youth Movement. Like they studied the tax returns of of these supplies that were still making its way to Israel, and we could track it through different ports and through the U.S. And so, of course, these things are still happening, and Canada's still buying weapons from Israel, still maintains a free trade agreement with Israel. All the while, Israel is at the International Court of Justice trying to defend itself against the accusation of genocide, but has been also ordered, provisional measures over a year now to prevent genocide. And it continues to wage an illegal war on its neighbors, on
Yeah.
Lebanon, on Iran, and so I think I think it feels so far away, but the impacts are on our own communities, on our own people that we love in our own community. Very recently, Bill C-12 and its impacts on canceling applications for refugee status. Like this has already hit community members who have evacuated and left places like Gaza in our own community. And so people are being are facing deportation because of these horrible, horrible laws that the Liberal government have been able to push through despite not having a majority government. And with this upcoming by-election, I think it's a pivotal moment to um, really push and fight back because what the Liberals can do with a majority government, I think, has already been signaled with what they've been doing for these past couple months to the past year.
Yeah, very much agreed. And we've also seen recently with Mark Carney saying that we will never participate in a war with Iran immediately after walking back his full support.
Mhm.
Um, it's disturbing because we have also seen um, the only pushback again come from the NDP. NDP MP Jenny Kwan put forward a bill, C-233, the No More Loopholes Act, pointing out that through our NATO agreement, the US is not subject to the same requirements as every other country on the earth. Like they're literally the easiest country for us to send not just arms, but military equipment. And we're seeing that with Canadian produced military vehicles being used by ICE in the US. Um, it and so Mark Carney and most of the Liberals, although to their credit, some of the Liberal MPs did vote in favor of Jenny Kwan's bill. The Liberals, the Conservatives, and the Bloc voted in tandem on not moving forward with that bill, and that to me says we need to have a serious conversation about our NATO obligations if we're also saying that Mark Carney is the guy to elbows up against the U.S. And Mark Carney is also he's proposing a bank that is entirely devoted to military spending. Where do you think that's going to go? They're calling it defense funds. But how are you claiming it's defense against a potential engagement with the US when you're continuing to make them, again, the easiest country in the world to send weapons to and our primary um, trade partner on that? That deepens our reliance on our trade relationship with the States. It doesn't remove it. And if the weapons that we're manufacturing are going to arm the person that is threatening to take us over, um, and to make us complicit in many ways in wars that many Canadians, that the majority of Canadians don't agree with, then you're kind of, I'm just going to say it, it's hypocritical and it doesn't make sense. The other place where we are continuing to be complicit is exchange officers. So the CBC did some coverage on the history of the use of exchange officers when there are engagements. And this was done during the war in Iraq as well, where if a Canadian soldier was already in position at working with another government, they would continue to be involved unless explicitly told, ordered not to, right? And so that includes things as directly involved as choosing targets during a war. And you can't say we're complicit if we're sitting there with our own officers deciding who gets bombed and where. It's just not it's not honest to say that we're not involved and that we'll never be involved when we actually still currently are. And I think it's really important for the NDP to play a role in holding the government accountable on that because most people, they again, you're right, they hear it and they think, oh, well, Carney's a good guy, right? Like he wouldn't be dishonest or especially what I've been hearing at the door is he's got a fine line to walk and I'm like no, that's just a lie. Like he's just lied to you and we need to be We need to hold him accountable. We need to have those conversations directly and with all of the information we need to be able to make informed choices as voters. I'm really concerned about this sort of daddy Carney vibe, which is just rebranded paternalism. Leaders should be able to be explicit and accountable about their decision-making process with an informed electorate. That's what democracy is. And we're slowly shifting away from that. And so yeah, I am really, really concerned about a majority government. So yeah, let's punch up. Is there anything else you'd like to add before we finish off today?
No, I think you made some really excellent points. I would just add, like I remember sitting in the House of Commons during one of the debates for Jenny Kwan's bill about closing the loopholes with arms shipments to the US, and hearing the arguments by the conservatives, by the liberals, and partly by the bloc, even though the bloc actually said we kind of agree with this in theory, in principle, but the way that it's like being implemented, we have fears that it's not going to achieve what it wants to achieve. But the arguments from the conservatives and the liberals were not to challenge the fact that weapons from Canada are going to the US and finding its place in places where like crimes against humanity, war crimes, genocide are
Yeah.
taking place. Because that's not arguable at this point. It's not. What their arguments were about were, you know, maintaining this relationship with the US, keeping businesses, these small businesses that mean well in Canada, that, give Canadians jobs. We need to keep that going. These were some of the main arguments that
Will
they're
someone
making.
think of the arms manufacturers?
And it's just, like I I think it's hard for everyday people to watch CPAC, like the parliamentary kind of like television updates about what's happening in the House of Commons. And I also know like when everyday people in Canada somehow tune in to Question Period because they visit Ottawa for like a family vacation or something or a school trip, and they listen to Question Period and they just see bickering politicians who sound like they are much like much more innocent and naive than they actually are behaving, but in this way that's like bickering and this infighting, and then you leave with the sense of like, oh my gosh, I can't believe these people actually run the country. And then you're like, okay, well, I guess that's the way that things are. And it's like it doesn't have to be this way. And I think if people actually listened and were like, wait, this is their argument that we need to, keep jobs in Canada, and I think and we need to um, put more money into this system because it creates good jobs. Well, there's many ways to create good jobs in this world, and I think many people can understand the importance of having good jobs so you can, have a good income to provide for your family, so you can buy food, buy gas, buy rent, all these important things that people are struggling with. Um, but it does not have to come at the cost of engaging in war crimes and crimes against humanity and genocide. And I think so many people actually believe this, that like it doesn't need to be this way. And yet their elected representatives are saying something completely else because they are supporting this kind of like industry, this propped up system, this economy that is actually pulling the entire world into a place of irreversibility, whether it
Yeah.
be the military industrial complex or, the fossil fuel industry, where we're getting to a place where because of the climate crisis, because of all these different factors, we're getting to a world that is unlivable in the future for future generations, if not the current one. And so I think if people are truly paying attention, then we have to push back against these kinds of rhetoric and practices by governments, and especially our current government that is arguably, by so many, the most conservative liberal government that we've seen. And I think just a few days ago, I saw um, some conversation about, quite a few conservative MPs still being in talks about crossing over to the Liberal Party because they're really happy with what the conservatives, they're really happy with Mark Carney and his rhetoric and his policies. And it just really shows how governments, including in Canada, are just being pulled to the center and then to the right as we go. And I think to be unapologetically this is the stance that we have on the left.
Yeah.
We want everyone to do well. We want to lift up everyone, and you should not be punching down on the most vulnerable and most marginalized people in our communities in Canada. In fact, we have to be punching up to those that are the rich and powerful, that are the out of touch politicians that are making these decisions with the interests of corporations and CEOs in mind, because those are the people that they're talking to. I do think this is the politics that will move society towards one that all of us are able to survive despite this current existing impossible economy
Yeah.
that many people are struggling to get even by right on a day-to-day basis.
Yeah. Supporting the war on Iran did not make groceries cheaper. It didn't make fuel cheaper. Didn't make life cheaper. It didn't save us anything. But it made a lot of people a lot of money. And um, when I was in the States actually doing my master's degree, I was so curious because I grew up in this healthcare economy, something that we're so proud of, right? And we were talking about, we've expanded into ideas of communities prescribing, and that can go under the healthcare umbrella. And we've seen incredible work on involving healthcare and supportive housing under the healthcare umbrella, and all of these things that can come in and be integrated under an ethos of care. And that's what it means to have a healthcare economy, right? Most of the money goes to healthcare, and then we integrate other related work through it. We can build affordable housing that way, and that's the ethos of care. But when you have an economy of war, it all goes under the umbrella of war, and we've seen that in the U.S. So when I was doing my master's degree there, I was meeting all of these students that had to enlist in order to afford university. I was meeting physicians who were, not really part of the healthcare system. They were part of the military. I was asking, it was such a common question for me of like, if you could do the exact same work, but under a healthcare umbrella, would you do it? And it was an interesting conversation because some of the people had been in it so long that they'd really just taken on this military persona. There was pride in military. There was instead of leaning away from stereotypes like a lot of Canadians do, they really like leaned in like it was the brand. Um, but most people that I talked to said, I would absolutely prefer to do this under an umbrella of care and not self-perpetuating war. And we know what that looks like already because of what's been happening south of the border. Why are we moving in that direction here? And how do we see that as an intelligent move? If we do need to defend ourselves from the US, then we can't be that intertwined. It's just not it's not a defense strategy if you're then just handing them the weapons, and all of the weapons you purchase are manufactured by them. We had this conversation about aircraft. Like, if it's been manufactured in the States, is there a button in it where they can just, in mid-fight flight, be like, no, let's self-destruct? So, yeah, I don't think it's what Canadians want. It's not what I know of Canada. I don't think it's what a lot of Americans want, frankly, either. And it's a disturbing direction for us to be going in. I don't want us to keep walking down that path. And as MP, I think that would be a very primary focus for me. Regardless of how many, and we did have this conversation, regardless of how many conservatives cross the floor, even if there is a liberal majority, the University of Rosedale is an incredibly progressive place. If you look at how they vote provincially for the NDP, we know that we have a lot of NDP support here. We still have to push back. We still have to have progressive voices. We still have to say something against it at the Hill. So we run our own race and we keep fighting for it and we push for progressive voices. And I think we can win this. I'm seeing the tide turn, so I really appreciate you being here to have this conversation as frankly as possible so people can understand what we're up against.
Yeah, thank you for having me in conversation with you, Serena. I'm sorry I couldn't make it in person, but
Okay.
I'll be cheering you on and the team from afar.
Okay, do you want to do a punch up? Punch up.